So what is decommissioning in healthcare? Basically, we use the term decommissioning to refer to any planned processes of replacement or removal or reduction in healthcare services. First of all, it's important to look at decommissioning just because it's happening currently on a scale that we perhaps haven't seen before in the NHS and in systems around the world. And there are a number of drivers for this. Firstly, arguably, it's in the interests of patients for services that are perhaps outdated or not effective to be replaced, to be reduced, and for investment to be put elsewhere in line with changing needs of patient populations and so on. That's the kind of positive case, if you like, and why it's important. But the other side of it is that in reality, lots of decommissioning is actually driven by the huge financial pressure that healthcare budgets are under. And this is perhaps the negative side of decommissioning, or drivers of decommissioning. And in reality, often those two agendas, the quality and the affordability, are not particularly well aligned. So I think there's a need to explore in practice what drives decommissioning, the experience that people have, and the outcomes and the equitable outcomes for patients and patient populations. We've just finished a 4-year project funded by the National Institute for Health Research into decommissioning in the NHS. And the idea was really just to try and explore the experiences of NHS service planners and decision makers trying to undertake and to implement decommissioning plans. So really we were just interested in their experiences, seeing what happens, what influenced whether plans were implemented as intended or perhaps unsuccessful. And we also had a stream of work which was looking at the experiences and the perceptions of those affected by decommissioning proposals and plans. So that included service users and patients, their carers, other stakeholders such as perhaps independent service providers, and also just members of the public. So we really wanted to get that rounded perspective on the topic of decommissioning as from a research perspective. But we also wanted, in line with the funders' requirements, to come up with something useful for those intending or planning to lead these contentious processes of healthcare change in the future. So we tried to generate some kind of good practice, insights and principles for them as well. In terms of good practice in decommissioning, we basically concluded that there's no blueprint that can be applied in all settings. And also that perhaps when trying to do decommissioning, it doesn't make sense to think about it almost as a kind of extension of business as usual, if you like. So it's something of a special case in terms of the nature of the change process and the reactions and the politics that surround it. So your usual approach is to, let's say, evidence gathering, consultation, and even kind of workforce planning are different, I think, when it comes to decommissioning and some of the reactions that it generates. I think there needs to be more of an emphasis on the relational aspects, the need for trust, the need for sharing your plans, gaining as wide a support as you possibly can with stakeholders and local communities, really kind of having that discussion in an open and honest fashion. And I think also planning more for the long term. So I think it helps to think of decommissioning as the end point in quite a complicated and difficult process of exploring options, building relationships, and agreeing a case for change, rather than seeing decommissioning as the beginning of a process. So the research that we carried out threw up lots of interesting, perhaps further questions or other areas that need to be explored. Key amongst those, I think, is how we measure the outcomes of decommissioning processes. So often we consider a change process when it's implemented for that almost to be a success, but really the measure of success is the impact on patient populations, impact on health, impact on equity. So I think those are really important future areas for researchers and the system to explore. Also, I think more needs to be done to understand how we should go about those difficult conversations between the actors in the system who are acutely aware of the limits to what can be provided and the need to make these tough choices, and perhaps external parties such as local communities, such as service users affected by some of these difficult decisions? How can we conduct those conversations in a way which isn't tokenistic, but which reflects the realities that this system faces financially? So it's really, really tough conversations. There's some room to explore how we do that much more effectively than we currently do.